Dr. Robin Schoenthaler is a highly respected physician in her field, a mother of two, and a creative writer. Dr. Schoenthaler started out her career in medicine in 1992. Eventually, she discovered both a talent and an affinity for writing.
About 15 years ago, I started writing. And I mean, I'd always been a writer and a letter person and that sort of thing, but I started writing and then eventually writing for publication. And a lot of the writing that I did was to sort of process all the things that I was learning in the cancer clinic. And then it began to be sort of teaching about what I learned in the cancer clinic. And then it expanded into, sort of interesting things that happened in our lives and in Arlington. And yeah, it was really super fun to write and then also be read. Turned out I liked being read. And then in the last few years, that's actually expanded into storytelling.
Dr. Schoenthaler received a lot of attention for one of her recent opinion pieces. I'm a doctor who tried to plan an extremely safe Thanksgiving for 3 people. It wasn't worth the scare it put us through. An experience that was originally posted on the Arlington list. The article was featured in prestigious publications such as the Boston Globe and Business Insider.
So basically what we did was we said we want to have the safest Thanksgiving we can possibly have following the science. So we'll all, mostly stay home for a couple of weeks before we get together. We'll only be together for a couple hours. We'll sit really far apart. We'll have masks on all the time, except when we actually have a fork in our mouth. And we'll cook at home so we don't spend hours in the kitchen together. And we'll just do this tiny little Thanksgiving and we'll still be together and it'll be wonderful. Well, it would have been wonderful, except for 48 hours later, my oldest son got COVID, which meant that not only were we devastated that he was ill, but it also meant that the other people in our little family had been exposed when he was contagious, since the hallmark of COVID is that you can spread it when you don't know you're sick. You're contagious for at least several days before you manifest any symptoms. On the heels of that, I decided to pitch it to the Boston Globe. And that took a couple days, but they ended up publishing it that week. And then, as I said, Business Insider reached out to me, another outlet called Scary Mommy, which has 8 million followers on Facebook.
In addition to continuing to treat her patients at MGH's cancer clinics, Dr. Schoenthaler plans to keep writing about her personal experiences, funny, sad, or happy, as well as provide insight into medical science for as long as people continue to read her work. She has recently carved out a particular role for herself when it comes to COVID-19.
Now I call myself a COVID translator, but it definitely comes from being COVID obsessed. It's a couple things. One was my medical training was very much hugely influenced by the AIDS and HIV epidemic. It was literally bookended. We didn't know what the disease was at the start of my medical training, and we had tests and the very earliest of treatments at the end of my training. And since my training was like 12 years, that was a long time to watch an epidemic come and go. And I had 1 million AIDS and HIV patients. And that's a hard thing for a young doctor, to have the majority of your patients be terminally ill at that time. So I had several ways of coping with that kind of a very tumultuous training. And one of them was to learn about the history of epidemics. When this started, once it became apparent that it was not going to be just another H1N1, another thing that we were afraid was going to be a pandemic and then dissipated. Once I realized that, then I found all those same interests sprang back up, and all my sort of interest in seeing how this pandemic was going to fit into the history of pandemics, that came up. And one of my philosophies in all of this is that the science will save us, which was a big shock to a lot of people. I mean, I think a lot of people thought this was not a salvageable situation. Or I'd say I have several mantras, and another one is all epidemics always end. That's what I learned from the history of epidemics.